All right, so hello everyone. Dr. Mustafa here along with Dr. Neha.
Hello everyone.
And we are actually very excited to welcome you all to our new channel, NDEB Strivers. So from the name, NDEB is the National Dental Examination Board of Canada. And we know that the NDEB has been given the mandate to establish actually like a single national standard for dentists here in Canada, for general dentists. And Dr. Neha and I, we are both in this process of tackling the NDEB process and the exams. And we are here today to just talk about the goals that we are trying to achieve actually from creating this channel, and to let you know how we are going to try to help all the other people or the other dentists who are also in the process of the NDEB exams. So to start with, we will talk about the why are we creating this channel, Dr. Neha, right? So let's see. So this is the first point for us for today. Why are we starting NDEB Strivers channel?
Yeah. So the problem I most commonly encountered when I started studying for AFK was that I was not sure of the resources, though there is a list of resources, like it's a long 14-page list which mentions about the articles and the books, but I was not sure what to do with them.
Yeah.
And so the second point was that I was new to the pattern. As if we know that the dentistry is same all over the world, but different type of exams, they like judge you on the basis of different criterias. So what I've realized from my experience is that NDEB, it tests you more on the basis of the concepts and the reasoning. For example, like you say that if you know that it is not sufficient to know that nitroglycerine is to be given in angina attack. You also need to know that what all doses is to be given. Like if there is an angina attack, what should be the position of the patient? Like if after giving like 2 or 3 doses, what you should do next? And what are the contraindication to the nitroglycerine? So it is like, it is a type of exam where you should know it all.
Yes.
Also, when I started, I was looking for the Facebook groups and the YouTube videos. So there are a lot of Facebook groups on, so on AFK, there are a lot of Facebook groups, but in those groups, you are on your own. There is like nobody will like teach you. So you can ask your queries, you may get answer to those queries, you might not get answers to those queries. So we have an objective of having a Facebook group where we are active, and instead of like having people on their own, we would like and for us also, we'd like to actively participate in that, and we'd like to like explain concepts and videos and like references and text. So we're going to do everything in that group.
Yeah, so it's what I noticed is that on most of the Facebook groups, people would just say an answer without elaborating and letting you know exactly why did they go with that answer. Like, what are the reasons? What is the concept? What is the source for the reference? So what we are trying to do is to create this channel to try to talk about different concepts and using the references that are actually used from the NDEB themselves, and on the Facebook group to try to post some questions and to try to give reasons, the whole concept for the answers that we will be given. So that's
So basically we are trying to do something which we were devoid of.
Yes, and we didn't find actually. Yep.
Yeah.
So from, like, as you said, so Dr. Neha and I were both still in the AFK process, and that's why we are going to be targeting and tailoring all the contents of the channel and of the Facebook group for now for the AFK exam. So I just want to say a simple kind of like question also comes to a lot of people is, like from where exactly should I start for the AFK exam? So just a simple answer for this is that if you join the Facebook group that we are creating, we will post the released questions that are already in the NDEB exam website, and we will try to give you some, like it's always very good to try and know exactly the references that you can look for to answer those questions. And many people, they would take the questions and only the answers, and they actually don't go and dig deep into the concept behind the question. So if you find a question asking you about the treatment for reticular lichen planus, don't just answer that question and move on. Go and dig deep into the concept, all of it, the whole topic. The lichen planus is an important topic. You need to know it in and out. You need to know the different types, the different modality, the different treatments for the different types, because treatment for the reticular type can be so different than treating the erosive type. So always try to go and dig deep into the questions. So I would say start with the released questions, download the references, and try to look for the answers, and then go and read around the answers and read about the concepts that are there. So for the next point is also a very important point, which is the importance of the articles that are actually mentioned. So Dr. Neha will let us know a little bit about that.
Yeah. So as we know that there are articles and books which are given in the NDEB release, like the reference list. So as we know that for the books, it is not possible to read all of those books, but for the articles, it is. There are roughly around 26 articles on the website. It may seem at first that the 26 articles are a lot of articles, but when you weigh the percentage of their importance as compared to the number, I think it's a wise decision to go and read all those articles. So out of those 26 articles, the majority of the chunk is that the one from the AAPD, that is the American Association of Pediatric and Preventive Dentistry. There are around 11 of them from the AAPD, which talks in detail about the pulp therapies, about the newer technologies like the SDF, which is new in the market, and all sort of things. Then there are 2 articles from the American Association of Periodontology, which also includes the newer classification, which all of us know is very important. And many exam questions are based upon those classifications. Then 2 of them are from the AAE, that is the American Association of Endodontists. One is from the AAO, that is the American Association of Orthodontics. One is a radiology article, which is from the ADA, that is the American Dental Association. 3 of them are from the AHA, that is American Heart Association. So as we know, there is an update for the prophylactic drugs also for the
Endocarditis.
Yes, for the infective endocarditis.
Yep.
So yeah, so with all these articles, it is the main purpose of the articles is also that they want us to be updated. So all those questions, they are mainly based upon the updated knowledge and not the outdated knowledge from the book. So that is why it is very important to read all these articles.
Yep.
Then there are articles, so 2 of the articles are from the Royal College of Dental Surgeon of Ontario, and 2 are from like the ICCMS and the TMD, the TMJ disorders.
Yeah.
So maybe in the coming videos, we're going to talk in detail about these articles and the importance of the articles, the important points from the articles, and maybe we're going to have an individual videos on the each one of these. Yeah. So this was all about the articles which are there on the list, and it is very important. So now the next question which we have when we start with the channel, the next question is for Dr. Mustafa. So he's going to tell us if self-studying is sufficient or is it important to take any course?
Yep. So I would say from my own experience, Dr. Neha, I did the exam before in February and I scored 73, and we all know that the pass is 75. So for that time, I actually prepared for the exam by myself. I didn't join any course, and I would say it's like joining courses can really be beneficial in terms of having some guidance and having also like the teachers or like whoever did this process before, they already did the search for you. They already did all the like the meticulous kind of like just digging deep into certain kind of concepts to try to reach to certain conclusions that are like in a way trusted as concepts for you. So I would say it's better to have a guidance. Like I did it myself, I tried it. I would say even to myself, if I can go back to in time, that I should have like really joined maybe a course to to guide me more, and to maybe have also like some mock exams to just even have the mental kind of preparation for the long like kind of session of the exam itself and everything. So I would say all in all, self-studying can be okay, and you can definitely pass only by just doing that. I only failed missing 2%, but at the same time, joining a course will make you have some benefits of meeting other people that are also taking the exam, having some guidance, having some work that is already done by the people who already they are giving the course themselves. So that's also something that we might be talking about in the future, our experiences in the different courses, and maybe also like giving some tips about like the different kind of people who are giving courses. So that can be also happening in the next videos. So that can also be, or people can ask us like maybe in the Facebook group to give them some tips about what to do from our own personal experience, like nothing else. So about also like the same kind of concept about like just am I studying by myself? Am I having a course? Do I need a group to study with? So how about this, Dr. Nia? So like, what do you think about what kept you motivated for the studying generally for the AFK?
Yeah, so since we know that we need to give a good amount of time for this exam, which is usually like 4 to 6 months. So for this long amount of time, we should find a ways to keep ourselves regular and to keep oneself motivated. So being motivated, it is a very subjective kind of concept, and what might work for one person might not work for another.
Yep.
So if you're good with the schedules and following a timetable, that is perfect for you. If that is working for you, that is perfect. So if you'll ask myself, studying in a group, it helped me a lot, because what I have seen and what I have realized with my group is that when you're studying in a group, you have like, there's a more room for the healthy discussions. And if you are discussing the things, it might clear your concepts which earlier were not clear. And if you have a clear concept, it might reinforce your concept so that you do not forget it in the exam where you need to reproduce it. Also, with the groups, you come up with the great ways and techniques to memorize things, because like there are, instead of one brain, there are like 3 or 4 brains working out together. So yeah, you can opt whatever way is good for you. So whatever ways works best for you, you can go with the group or with the individualized study with the timetable and schedule. But at the end, it is very important to be regular and to be motivated.
Yes.
Yeah. So
for sure.
yeah.
Yep. So the last point that we want to talk about here about why are we starting the NDEB Strivers channel is the level of uncertainty that is becoming actually very high with the AFK exam since the change in August 2021. So we all know that in 2021, in August, in 2020, actually, the last exam in 2020, the NDEB decided that they will cancel one of the exams, and they actually then even postponed another February exam, and they canceled it. And then they changed the bank for the questions, then they changed a lot of things. So that's also, this point is also to reinforce the fact that people used to always only just look at certain questions and know the answers. Now it's not enough. So you really have to read all about certain topics in and out, know them in and out, and there is more uncertainty about bringing new topics, like we have seen it in August, February, and this August. There are new concepts that are being tested, new updates, and new things that are happening. And that also reinforced the fact that Dr. Neha just said about the importance of the articles and how it's very crucial to know them in and out. And in this channel, we are really trying to help with that. We will try to simplify the articles and have them in PowerPoints, very simple, and try to just make videos explaining the concepts in them. So that's also part of our goal from creating this channel. So AFK is now not as easy as it used to be. And that's from whoever took the exam in the last 3 cycles, they will all tell you that. So to try to conclude, so what are the things that we will try to do to help Dr. Neha?
Yeah, so here we're going to provide guidance based on our recent experiences with the AFK. We're going to simplify the articles which are provided on the NDEB website. We're going to make videos on the high-yielding topics that are coming up more often with the updated AFK exam. And also, as we said, that we're going to have an active Facebook group with the questions and discussions and everything we need for the AFK preparation. And also with this, we can have an open discussion. So you can mention in the group, or you can comment in the YouTube, under this YouTube video, about the things you want to know about. If you have any query, or if there is some topic you want us to make a video on, so we can do with that also.
Yes, for sure. So that will be it for this introductory video. Thank you so much, Dr. Neha, for your help regarding this, and thank you so much for everyone who's been watching all the video, and subscribe for more updates. And we will have also the link for our Facebook group on the description below. So thank you so much, and we will see you on the next video about the articles and the different references, and make them more simpler even for people.
Yeah, happy studying, guys.
Thank you so much. We'll see you on the next.
Thank you, Mustafa. Yeah.
Take care.